Global Fund came into my life a number of times, later with antiretroviral therapy. Now I'm talking not only as a representative of the community and a person with experience, but on the daily basis I'm serving hundreds of thousands of people in the Alliance for Public Health, covering the largest harm reduction program in this Eastern Europe, Central Asia region, and the largest in the world if we take Global Fund funding. That's of course an honor for me to share my experience on the daily basis with the people who are facing the same troubles as myself. And that's why I'm proud also to say that I'm proud to be one of the 65 million lives saved by the Global Fund. Well, as I mentioned, as we all know, Ukraine, war, emergency context. Emergency context is not something new because of the COVID before that, and with Global Fund programs we also have a number of lessons learned. And thanks, Global Fund was the first organization, despite of the big institution, you know, with a certain bureaucracy, etc., but it was first organization who actually helped us to immediately reprogramming the finances and to do what we have to do in this emergency war context, to save, to avoid the interruption of treatment, life-saving treatment, to save the people, to provide the, you know, linkage to care, transportation, etc. But that's still happening, you know, it's, as of today, more than 600 of healthcare facilities are completely destroyed or partially destroyed, so people kept dying. But at least even in these difficult times, Ukraine shows the example of using such situations as a window of opportunity. And even in these hard times, we're increasing the number of people on harm reduction programs, on opioid agonist therapy. Now we have 30,000 patients if we take with the private clinics, and it's amazing that despite of what is happening, we can do this work. Ukraine is a part of Eastern Europe, Central Asia, which is still the region with a growing epidemic. And we all know that unfortunately it happened also because of the criminalization, stigma and discrimination to the key populations who are suffering from HIV, TB. And that is why, of course, when we're talking about finances, we should be ambitious. We really have no time. And actually what I said on the conference, you know, the motto of the conference was put people first. And I said that, okay, we hear that we have all tools now in place, like we have treatment, we have prevention, we have everything. But what we don't have a time. If we're really committed to sustainable development goals to 2030, we really have no time. And that's why we need financing and we have to be ambitious. But when we're talking about financing, we're also thinking about effectiveness of use of this financing, right? And how we, on one hand, can buy lots of, I don't know, ARV treatment, and at the same time leave the criminalization framework for the people who use drugs or people living with HIV in certain country, which totally avoids them to go and to get this treatment. So I would like to use this opportunity, because as far as I understand, majority of you, it's members of parliament, former or actual, but still you are the people who create the legal framework, who creates the law, who can change the law. Yes, finances are key, but we really have to finally decriminalize, to change the repressive policies, and that's the only opportunity to win this fight with HIV, with TB, and with malaria. And of course, nothing about us without us. Please involve communities. Thank you.